Penguin Random House Audio presents The Emotional Lives of Teenagers, Raising Connected, Capable, and Compassionate Adolescents. This is the author, Lisa Damour, Ph.D. Note to listeners: this program includes a downloadable PDF that contains a list of recommended resources from the book. To D, my much better half. I take it that it is normal for an adolescent to behave for a considerable length of time in an inconsistent and unpredictable manner, to fight his impulses and to accept them, to love his parents and to hate them, to revolt against them and be dependent on them, to be more idealistic, artistic, generous, and unselfish than he will ever be again, but also the opposite, self-centered, egoistic, calculating. Such fluctuations between extreme opposites would be deemed highly abnormal at any other time of life. At this time, they signify no more than that an adult structure of personality takes a long time to emerge. Anna Freud, 1958. It is a deep comfort to children to discover that their feelings are a normal part of the human experience. Chaim Gnat, 1965. Introduction. In June 2021, I got a call from a friend I've known since middle school. We caught up briefly about what had happened in our lives and our families since we last talked, and then she said, "Actually, there's a reason I'm calling. I'm really worried about Will. Can I run something by you?" Of course, I replied, recalling that her son Will, like my own older daughter, was about to be a high school senior. A couple of weeks ago, we learned that my husband's company is transferring us to Seattle. We're moving at the end of the summer, and Will is a mess about it. He loves his friends and his school here in Denver, and he can't believe that we're uprooting him right before his senior year. He's been incredibly cranky, and in the last couple of days, he's even gotten tearful about it. I don't know what to say to make things better, and I'm getting worried that he might be depressed. Is his mood down all the time, or does it rise and fall in waves? I asked. It rises and falls. When he's not thinking about moving, he actually seems to be okay. He has a job that he likes, and he's plenty happy when he's hanging out with his friends. But when the topic of the move comes up, he gets so sad. I don't know what to do and can't tell if I should be worried. Listen, I said, I don't think he's depressed. But let's stay in close touch, because I'll want to know if his mood stops going up and down and instead he starts spending most of his time feeling cranky, numb, or blue. From what you're telling me, it sounds as if he's unhappy specifically about the move, that he's feeling sad and angry about it. Absolutely, said my friend. But I don't consider these grounds for concern. Actually, I think those feelings are evidence of his good mental health. Really? How? Well, being upset about moving right before senior year, especially when he's happy in Denver, is an entirely appropriate response. I'd actually be more worried about Will if it didn't bother him at all. That makes sense, I guess, my friend said, but how am I supposed to help him through it? There are two things you can do. First, reassure Will that he's having the right reaction. Just as it's hard for you to see him so upset, having such painful emotions is probably uncomfortable for him, too. You can help to put his mind at ease by letting him know that what he's feeling makes sense. Second, try to get comfortable with the idea that he's probably going to continue to be unhappy about the situation, at least until he gets settled in the fall. Rather than working to prevent or chase away his discomfort, focus your attention on helping him find ways to manage the distress he's feeling. For teenagers, powerful emotions are a feature, not a bug. This has always been true, but these days it seems to be less widely understood. The past decade especially has been marked by a dramatic shift in how we talk and think about feelings in general, and, in particular, about the intense emotions that characterize adolescence. To put it bluntly, somewhere along the way we became afraid of being unhappy. When I received my first license to practice clinically as a psychologist nearly 30 years ago, I had been steeped in a training program that embraced the full range of emotion, a spectrum of feelings from the most pleasant to the least, as an expectable and essential aspect of the human experience. My training taught me to regard adolescents' emotional landscapes with an observant, unafraid eye. I have always understood psychotherapy to be a joint enterprise in which I guide the teenagers in my care to share my curiosity about their inner lives. We work from the unspoken assumption that every one of their emotions makes sense, that their difficult feelings, anger, frustration, sadness, worry, and the rest, happen for a reason, even when the reasons for them are unclear. Though of course I'm there to help them feel better, the aim of our work is less about comfort and more about insight. When teenagers understand what they are feeling and why, they suddenly have choices that were not available to them before. To me, this is axiomatic. I have never doubted or questioned the value of welcoming even the most distressing or disturbing emotions into the light of my office. But as I've worked away in my practice, watching the process of young people discovering, understanding, and accepting their emotions and receiving much needed and deserved relief, I have sensed the culture around me changing. 20 years ago, I still felt myself to be part of a broader society that accepted, albeit begrudgingly, that painful feelings are a natural part of life. Today, I'm trying to figure out how uncomfortable feelings came to be seen as psychological states that ought to be prevented or, failing that, banished as quickly as possible. What changed? How did essential aspects of the human condition become unacceptable? How exactly this happened, I can't know for sure, but I have some ideas. Since the time of my training, 3 trends have emerged that may help explain the shift in how we view psychological distress: the proliferation of effective psychiatric medications, the rise of the wellness industry, and the climbing numbers of young people who suffer from mental health disorders. Let's weigh these one by one. Antidepressant medications have been available since the 1950s, but they were not widely prescribed until the late 1980s when Prozac hit the market. Let me say right here that Prozac and the many other psychiatric medications that have been developed in recent years dramatically improve and sometimes save lives. Before physicians began to prescribe Prozac in 1987, they worked with so-called first-generation antidepressant medications. While these drugs were often effective, they caused miserable side effects and could be lethal in overdose, a tragic problem when caring for suicidal patients. Then along came Prozac and, soon after, an entire second generation of medications that lifted depression and had minimal side effects. Suddenly, prescription drugs became a low-risk option for mood improvement. It's no wonder these drugs took off. In 1987, only 37% of those being treated for depression received an antidepressant. By 2015, that number had risen to 81%. During that same period, the number of people receiving psychotherapy for depression dropped by 20%. What drove these 2 trends? First, it's likely that antidepressant medication provided some individuals with enough relief that psychotherapy no longer felt necessary. Second, it's also true that insurance companies are far more willing to pay for pills than for sometimes costly talk therapy. To these explanations, I'll also add a third possibility. The proliferation of safe and effective medications to treat depression, and also to reduce anxiety, improve sleep, and focus attention, has altered our cultural stance toward emotional discomfort. Instead of regarding psychological unease as something to be explored and understood, we have increasingly come to view emotional pain as something that can be deterred or contained with chemical interventions. Numbers don't lie. Since the early 2000s, antidepressants have been on par with blood pressure and cholesterol medications as the most prescribed drugs in adult outpatient visits. To be clear, there is no question that psychiatric drugs ease human suffering. Further, no conscientious clinician prescribes these medications with the promise that they will solve life's problems or make people happy, because they don't. That said, I can't help but wonder whether the widespread use of mood-altering drugs has stoked the belief that somehow we and our children might and should be spared the reality.
Sample complete. Ready to continue?